Good evening, I am Gregory Zarian along with Suzanne Watley, and thank you for joining us on Healthline. You can catch us here every Tuesday night from 7 to 7:30 on Charter Channel 380, and we are always on the web for you at glendaleadventist.com/Healthline, and we also have our very own YouTube channel at GAMC Healthline.
Tonight we are talking about pharmacists, and pharmacists are so cool. They can do all kinds of cool stuff. They can prescribe medications, they can advise doctors and patients on the proper medications and the proper dosage. They can even run their own clinics. They can substitute generics for brand name drugs in order to save the patient money. It's really fantastic, all the things that pharmacists can do.
And it also takes 8 years to become a pharmacist. So tonight we're going to focus on pharmacists that participate in a hospital setting and how they are with their staff, the patients, and the community. And we're also going to spend a little time talking about community pharmacies and their responsibility to you, the patient. Because if you actually go to a pharmacist in a CVS or a Rite Aid, you are considered a patient, not a customer once you walk up into the counter.
We're also going to touch on the topics of the most prescribed drugs, such as Vicodin is actually the most prescribed drug, a painkiller. We're going to touch on some of those. We're also going to be talking about the superstars in the drug world and also some of the Me Too prescription medications, the ones that are reformulations of old favorites that are sort of more designed to generate revenue than to provide any breakthrough relief for the patients. So we're very, very pleased to welcome our two guests today. We've got Monica Ludwick and Romic Eskandarian, and they are both pharmacists at Glendale Adventist Medical Center. Happy to have you here. Romic, you are the director of the pharmacy.
Correct.
And you are the medication safety officer,
That's
Monica.
right.
So how did both of you get involved in doing what you do? Romic?
Oh, well, thank you, by the way, for having us. It is absolutely our pleasure to be here. I became a pharmacist. Actually, I knew a friend of mine who was a pharmacist and really admired about the things that he used to do, and that's kind of how it started. And I went to do my undergrad, went to pharmacy school, did my postgraduate training, became a clinical pharmacist, and got into leadership, and here I am, director of pharmacy at Glendale Adventist. I love it. It's great.
And Monica, how did you get involved?
Actually, my brother was a pharmacy tech during college, and so that's how I actually became familiar with the profession of pharmacy. And from there, I applied to pharmacy school after my undergrad degree, and the rest is history.
And most people don't realize that it does take 8 years and that you also have your doctorate.
Yes, it's a doctorate in pharmacy.
I think that's fascinating because I sometimes feel, as I was saying earlier before we started filming, that I feel that sometimes pharmacists are not treated the same way as doctors. And I believe that they should be treated with the same utmost respect because in a way you have the same amount of power to authorize what a patient takes and what a patient doesn't take. True?
It's true. It's true. I think speaking of respect, the respect is there. Not to contradict, but I believe there's a different expectation.
Then that's a better word, expectation.
Expectation. In community setting, for instance, since we work really closely with patients. In terms of, again, not the physicians don't work closely with the patient, but it's a moment that they ask very detailed questions about their medications or what have you. So there's a special bond between a pharmacist and the community. And of course, for our practice in a hospital pharmacy, as a clinical pharmacist, it's a different relationship with patients, which hopefully we'll talk about it tonight.
And coming up on Healthline, we're going to talk more about the responsibilities of a hospital pharmacist and the very important role that they play in patient safety. So stay with us.
Hi, are you a member of Facebook? I am because I like to know all that my friends and family are doing. Wait, did you know that Healthline has its very own Facebook page? All you got to do is go to Facebook, type in Healthline, find us, click like, and become part of the conversation about health, lifestyle, and the community. We post links, health tips, suggestions from you, the community, about what you do to lose weight, de-stress, have a happy, healthy lifestyle. Okay, once again, all you gotta do is go to Facebook, type in Healthline, and become part of the conversation. Hold on. Okay, somebody just posted that if you drink an 8-ounce glass of warm water with lemon, it starts to invigorate your metabolism, along with jumping up and down for 60 seconds first thing in the morning. Okay, you know what? I've got to pass this on. Become part of the Healthline conversation. We will see you on Facebook.
Welcome back to Healthline. We're talking about pharmacy with our two guests with Glendale Adventist Medical Center's hospital pharmacy, Monica and Romic. Thank you so much for being here. And we want to ask you, how do your duties differ from those of a community pharmacist?
Our duties differ from the community practice in a sense that we have far more accessibility to what we call clinical data. In terms of
what does that mean?
Clinical data in terms of we have direct access in terms of how the kidneys are functioning, how the liver is functioning, how the white or red blood cells are doing, and all the organs in the body in terms of laboratory values. And as you know, folks, every medication requires a monitoring parameter. Basically, the medications affect your kidneys, your eyes, your heart, your liver, your lung, your brain. And every organ in your body has a value, laboratory value that we could assess that. So the hospital pharmacists, they constantly monitor those in terms of, and the physicians constantly request the pharmacists in terms of pharmacy to monitor the renal function, which is the kidney function, or pharmacy to dose a medication.
So you actually pay attention as to how the body is responding to the medication that is given to the patient.
And what we call it is the pharmacokinetics versus pharmacodynamics in our field. So it is, you said it very correctly, as a matter of fact, Gregory, that how the body is responding to the medication and how the medication is actually acting against the body, which is the dynamic versus kinetics of the pharmacology.
So then both of you work together to make sure the patient is as safe as can be. How does that happen then?
The good thing about working in a hospital is that we are part of the multidisciplinary team. We round with the physicians, the nurses, and we see the patient picture in a whole, as a whole. And that really allows us to make sure the patient's receiving the optimal benefits, is receiving the medication at the right dose, at the right frequencies, and it overall improves the health of the patient.
So there are some of these medications that you've described as being a kind of fine line medications like Coumadin, these blood thinners. An example would be an easy to make overdose affected the twin children of Dennis Quaid, the actor, when they were at another hospital. They received a massive overdose. Fortunately, they recovered, but this created a big scandal, and it was an easy mistake to make. Can you explain how it was an easy mistake to make, relatively speaking?
Right. Well, there were several factors that played in part for that error to have occurred, but what happened was the main contributing factor was that the manufacturer of heparin made their vials look very similar. So it was a case of a look-alike, sound-alike, where the vials looked alike, and a 1,000 unit vial of heparin was confused for a 10,000 unit, and that's actually how the babies received that higher dose.
So that one little tiny zero on the package was overlooked by whoever administered it,
Right.
And blessedly
it's
they
true.
survived.
And that is one of our primary focus in hospital is patient safety. And as a matter of fact, Monica, playing a role of medication safety officer in the organization, her role primarily is to look at all the elements, what we call it look-alike, sound-alike, high alert medication, medications that have box warning. So Glendale Adventist Medical Center has invested to that very patient safety element. And again, we have a pharmacist that plays the role of officer in our organization, working with nursing, physician, respiratory therapist, and all the other disciplines, just to make sure that that safety element is always there.
But one thing I also want to throw out there too is, as you were saying earlier, about checking in with the adrenal glands and the liver and the kidneys, it then goes back to the patient themselves prior to everything and prior to being in the hospital to be very upfront with their family history, their medical conditions, their allergies, what they can and cannot take from personal experience.
Exactly, and I believe what you're referring to is the medication reconciliation. In Glendale Adventist Medical Center, we have pharmacists that they work in an emergency department, and their fundamental primary role of the pharmacist is to, when the patients come to the ED, they catalog the medications that they're taking, and what we call it, they reconcile the medications. And we process them. If there are any missing information, we call the family member, we call the local pharmacy to make sure that we provide the physicians very accurate list of medication so that physician can make the right decision in terms of what the patient was taking at home versus what's going to be prescribed
So
in the
then even
hospital.
if a patient says, I don't know, it's mandatory that they do know because you want to make sure that nothing causes a side effect or one medication hurts another medication.
Absolutely, you said it correctly. Many patients say, well, I'm taking that purple pill, I'm taking the water pill, I'm taking the blood thinner. But from physician and pharmacist,
Can you give us names, please?
We need to go back and research that, to call the family member so that the physicians, from the physician perspective, they understand what that blood thinner is. They could be anything, and from the prescribing perspective, a lot of things could go wrong if we don't have a clear understanding.
Well, in the emergency department, the ED, don't you often get patients who are unconscious and you don't know who they are? And,
Right, absolutely.
What family member to contact, much less what medications they might have.
Right, I mean, if somebody comes to ED with a motor vehicle accident, you're absolutely correct. We will not have that history, and we obtain that in a later time. But individuals that they do come to organization, and this is the message that we have to our community, that it is absolutely imperative for our patients, for our community members that are taking any medications, to have a log of medications that they're taking and have them in their purse or in their wallet or what have you. So if they come to the hospital, all of that is nicely cataloged and done.
But also too, though, I'm sorry for interrupting, is also please pass on your medications to your family,
Right.
so they know what they're doing. You know what, we're going to wrap out of this, and when we come back, we're going to talk about medication errors and what not to do in regards to you and the medicine that you take. Don't go away.
My name is Sen. I'm the pharmacy resident here at Glendale Adventist Medical Center, and I'm here to give you a nice health tip. Our role as pharmacists is to make sure that you are taking your medication appropriately and on time. We cannot stress the importance of being compliant with your medication and taking it exactly as prescribed by your physician. By not taking it, it could lead to increase in healthcare costs as well as detrimental to your personal health. So be compliant, take it as prescribed, and speak to your physician or pharmacist. So we are one of the most easily accessible healthcare professionals out there.
Tonight we're talking about pharmacists, and before the break, I asked the question, what are medication errors? So Monica and Romic, what are some of the mistakes that patients make in regards to their medicines? I mean, one thing you discussed was to always know what you're leaving the doctor's office with.
Right.
True.
True, that's very important. I know when we receive that prescription and we just see scribble, we assume that, oh, we take it to the pharmacy and the pharmacist is going to understand what it is. But if you don't know what it's for, it can be easily confused for another medication. There's been many errors that have occurred like that. And if you know what your medication is for, if you know what you're taking, it's easier for the pharmacist to make sure that you're getting the right medication. So that's a big key, is to always know what you're getting from the doctor.
Same thing with you, Romic.
Yeah, absolutely, and you talk about medication error in the patients that may, from the patient's perspective, I think it's absolutely important to understand how to take it, when to take it, how frequent to take it, and make sure to finish it if it's particular antibiotic or what have you. And we did, as a matter of fact, at Glendale Adventist Medical Center, our ED pharmacist, they asked this very question from our community, just to make sure we were measuring the competency of the community in terms of how they're taking their medication. And we found that majority, we had about 200 patients that we had interviewed, and majority had said that, well, I know what I'm taking the medication for, I know what the name of the medication is, but I always end up deviating from what I'm supposed to do in terms of I did it more frequent or less frequent, or I'm not finishing it. And I think that's a very, very important, because that is an error. I mean, from the pharmacist, we understand the dynamics and the kinetics of the pharmacology. And when the physician really directs you to take every certain hours, or do not exceed, or take it particularly in the evening or morning, or with food or without food, there is a reason behind that.
With
right
water,
there.
with milk, without milk.
Exactly. Don't go, don't do this or don't do that. And it is, there's a reason behind it. But most patients, most of us, including myself, I have to admit, we end up not doing that.
Well, you've got some inside knowledge.
And Monica's going to talk to you anyways, too.
Monica, talk about how sometimes you can have a buildup of a certain ingredient because you're taking it in different, say, over-the-counter medications. For example, acetaminophen. If you're taking Tylenol and you're taking Dayquil or NyQuil, and then you're taking something else that has acetaminophen, and you're not looking at the label because the writing is so dang small you can't read it. Talk about some of the problems with that buildup.
And you just want to get better, too.
Right, and that's one of the key messages I give when I work in the community, is always read the labels, because patients think, oh, this is for my cough, and oh, this is for my stuffy nose. We don't realize is this medication combination has acetaminophen, or this one has acetaminophen. And what happens is they, excuse me, they end up taking a double dose, and on top of that, they'll take it again because they have a headache, and they'll just take the plain acetaminophen or Tylenol. So if you have a question whether or not, sometimes they list it in the generic name, and you don't know that it's Tylenol, or that acetaminophen is Tylenol, to always ask a pharmacist, because the pharmacists in your community are there. It's completely free consultations. You can always ask, and they'll be happy to steer you the right way and what combination drugs to avoid.
So I could just go into my neighborhood CVS and plop down the bag of medications and say, tell me what I'm doing right and wrong about taking all these together. They can provide that kind of service.
That is our due diligence.
Yeah.
That is our responsibility.
But then also back to side effects. The patient also needs to say, okay, maybe this is what I'm taking, or this is what I've taken. What are the side effects with these, and how are they going to?
Well, when you talk about side effects, you've seen on a TV.
Well, sunlight
I mean,
can be a side
they
effect.
name a drug for rest of more than 50% of the advertising time. They talk about the side effect of the medication, and you're thinking, why would I take that?
Well,
medication?
I just think you're losing money, bloating, cough, bleeding, lack of sleep, nausea.
Right.
But take it, you'll breathe better.
Yeah, but I think what the pharmacist could play a role in that case scenario is to talk about, what are the side effects that could be related to you specifically? Because the pharmaceutical companies, they have the responsibility to make sure they talk about all the side effects that occurred during the study. But not necessarily everything will happen to you particular to your condition. So again, pharmacists could play a very key role to explain and what are the most common, or what would be a really serious side effect, and what to look for. Sometimes patients don't realize that they're experiencing that side effect. But again, how to advise them that what to look for, that you will recognize that you're having that side effect.
And also pay attention to how you're feeling and how you're reacting to the
Exactly,
medicine.
absolutely.
You can have a snowball effect too, where you're ending up taking many medications because
Right.
you take a new medication to counteract the side effects of the previous one, and then next thing you know, you're
Absolutely.
on 10 different medications. When we come back here on Healthline, we're going to be talking, I think, about a really interesting topic, computerizing the records that pharmacists use, that doctors use to convey their prescriptions. There's a lot of jokes about the chicken scratch that doctors do on their prescription pads, but the unfunny fact is that a lot of those lead to some harmful or deadly prescription errors. Stay with us here on Healthline.
Hi, I'm Mike Miller. I work here at the Glendale Adventist Outpatient Pharmacy, and I'm here with a health tip. It's a good idea to keep all your prescriptions at one pharmacy, and especially when you're on multiple drugs. We do have computer programs that will pick up on any drug interactions or duplications. Often these can be very toxic and harmful if you have two drugs that are interacting. Contact your doctor if needed. Thank you.
You know, when you take your animal to the vet, all of that animal's records are on a computer. Well, why aren't we doing that in our hospitals and in our doctor's offices and in our pharmacies? Well, we are, and it's a slow but steady rollout. And our guests, Monica and Romic with Glendale Adventist Medical Center's pharmacy, are here to brag a little bit about what Glendale Adventist is on the path to doing.
Yes, thank you. Yes, and what we call that is a CPOE, and stands for Computerized Provider Order Entry. And our organization, our corporate, we're very proud of that. We're introducing that piece of technology, and what's behind it is nothing but safety for our patients. And basically, in a layman's term, what that really entails is that it eradicates the handwriting elements of the healthcare practice, let it be from nursing, physician, respiratory therapist, pharmacist. So all the orders will be placed in the computer through a computer electronically. So again, no more handwriting. And what that brings to the healthcare practice is reducing, or I would say tremendously alleviating the medication error, which is that translation of the medication. It tremendously enhance the efficiency of the medication delivery because there's no lag of, order was written,
there's not as many questions.
Right.
Exactly. And you need to call back the nurse or the physician to verify what that was, or the telephone orders that potentially are coming through the organization, that the physician will be able to just log in from their home and place their order while they have accessibility to the patient's laboratory values and the entire healthcare record. So actually, I'm very proud of being in the Glendale Adventist and witnessing this piece of technology that is being introduced in the first quarter of 2011.
That's fantastic.
Excellent.
128 million prescriptions of Vicodin written a year. 3.84 billion prescriptions written a year. What are the top 3 prescriptions?
Pain medications are always in the top 3. I think Vicodin, Tylenol number 3, the hydrocodone-containing products are probably the most prescribed because they are prescribed by dentists, by physicians, you name it.
But same thing with dentists. Dentists need to see also what side effects are happening to a patient as well,
Right.
to see what they can or cannot take.
Right.
Number 2 would be high cholesterol.
High cholesterol.
The statin drugs?
Simvastatin
Yeah.
is probably one of the top drugs.
And then high blood pressure is a drug that's commonly prescribed
Right,
as
and
well.
there's a little bit of explanation behind that, Gregory, and that is, the healthcare is shifting more into a preventive healthcare. And we're finding out now these days that reducing cholesterol much lower than what we thought earlier, it's beneficial in terms of from your cardiac health. And same thing with blood pressure. Third item to be a blood pressure reducing. And we're finding out every year the regulation comes out that holding the blood pressure lower in the long term, it helps with diabetes, with all the other related disease states that are involved with a high blood pressure. So part of it, there's a reason behind it, and again, is a preventive measure, that preventive healthcare that exists out there in our society now.
Monica, what are some of the superstar drugs and what are some of the Me Too's?
Superstar drugs.
She was so excited asking that.
I am. I love just saying the word superstar.
I mean,
So
because
happy.
I could take that into many interpretations, but superstar drugs would be like the most common ones, right? Like our cholesterol
The best ones, the
medications.
most effective ones, the ones that just really make a difference for people.
Well, definitely, not to burst Monica's bubble there, but definitely, for instance, when it comes to, we talk about preventive, Plavix, maintaining, your, not to get too detailed, the antiplatelet aggregating drugs, or diabetes medications, or blood pressure medications, asthmatic medications. We're finding out once children that are diagnosed with asthma now these days, treating them much earlier, it's a definitely better approach than waiting much longer, throughout their years. So, superstar drug, there are a lot of antipsychotic medications, antidepressant medications that pharmaceutical companies that market for.
Right.
So
There's also a lot of sleep medications that we have a choice of. Lunesta and Avandia, and are these some examples of the Me Too drugs that you discussed?
Right, like you have Ambien, you have Sonata, you have Lunesta, and they're all part of the hypnotic drugs, or the drugs that are used for insomnia. And they're basically chemical structures that are all equivalent in the same sort of sense. And what happens is you have Ambien, which is now generic, and so these drug companies just try to come out with more
Options.
more options, make more brand drugs so they can charge more. For example.
So what is the most important thing you want to pass on to our viewer ask questions, pay attention to what it says on the prescription bottle. Monica, what is the one most important thing you want to pass on to our viewer?
Always ask questions. Always know what you're taking, and don't be afraid to ask for help, whether it be from your physician, calling your physician, or calling your pharmacist. Just know that there's a lot of people out there to help promote your well-being.
Romic, same thing with you?
Same thing, and understand about your disease state. I mean, if you're suffering from diabetes, if you're suffering from asthma or blood pressure, it's very important for you to understand about the disease. Once you understand about the disease state, then you understand about medication. Because as Monica mentioned, yeah, I need to understand about medication. But more importantly, when you also add I need to understand the fundamental, the pathophysiology about my depression. And once you understand the medication, you put those two together, it just makes much better sense.
And then you also get to monitor your life. Monica and Romic, thank you very much for being on Healthline tonight. We loved having you.
Thank you for having us.
It's a small little bottle that has directions. Pay attention to the directions. Someone actually tells you what to do and how to live a healthy and well lifestyle. Thank you for joining us tonight. And on behalf of myself and Suzanne Watley, the most important thing you have is your health. So have a conversation about it. Thank you.
Good night.